Please be advised that all video and audio recordings were completed before the COVID-19 pandemic.
Black Female Project.
Welcome back, everyone. This is Che Abram. In this episode, Leslie Stovall is in conversation with Dr. Jocelyn Freeman Garrick. I've known Dr. Freeman Garrick for well over 10 years, doing many things with her in my career and her career to support the next generation of healthcare professionals. But Dr. J holds a special place in my heart because she walked me through one of the most important times of my life that I had no idea was the most important time of my life. I was going for a promotion, and I asked her to give me a mock interview. And one of her questions was, tell me about yourself outside of your career and outside of being a mom. And I frankly didn't have an answer. I was stuck. I literally sat silent. I had no response. And so it sent me kind of on this pathway, and roundabout, it sent me to Black Female Project. And the best way I could give back to Dr. J was to invite her to Black Female Project so that you too can be inspired by all she does and all she has to offer. So let's listen.
So now, when did you know that you wanted to be a doctor?
You know, people have asked me that, and I struggle with that. I believe my mother told me I said that when I was in elementary school. I really don't think that I knew, though. I wore glasses and I thought I wanted to be an ophthalmologist. But I was so naive, I didn't even realize the difference between optometry and ophthalmology. So I actually chose Berkeley because they had a school of optometry.
They sure do. I almost went there. Mm-hmm. Almost went there, yeah.
And then when I was a freshman and went to the club, I was like, well, when do you do surgery and when do you do more? And they were like, you have to go to medical school for that. And I was like, oh, no, this isn't. So then I became pre-med and actually volunteered at Highland Hospital when I was an undergraduate at Cal.
You did?
I did. It was the best thing I ever did. I became hooked on emergency medicine. That's where the volunteers would work in the ER, just transporting labs and changing linens.
Are you an adrenaline person?
I'm definitely slightly manic, multitasker, constantly moving. Most ER docs have a little bit of ADD, need to constantly be doing something, always interrupting, mind moving ahead. So it definitely fit my personality. And then to be exposed to the county hospital with all the different socioeconomic classes merging, you know, for different reasons into this one little city was mesmerizing for me to see all the different languages and cultures in one place. I love that.
You have fused social responsibility and your medical training, do you think?
I don't think early in my career I knew what that phrase meant. I just knew that I related to a lot of my patients and I understood what their lived experience was and the barriers that they had.
Right.
And that my formal medical training wasn't addressing their disease in a holistic way. So, and I also realized that when I was a young resident starting my emergency medicine training in New York, that most of my patients, the providers didn't look like them. And I was starting to see some challenges, whether it was language or just, you know, relatability.
Right.
You know, we have a universal kind of, you know, Afrocentric look. So in New York, it's predominantly Puerto Rican, you know, Dominican. Most of my patients assumed I was Puerto Rican, Dominican. You know, I would have to say, soy negro, americano. They're like, no, mami, to Puerto Rico. But they related, right? They thought that I had something in common, and it helped with getting nuances in the history and physical and opening up maybe about something that you weren't comfortable sharing, but it impacts my differential diagnosis and how I could effectively treat you if you're honest about, well, I'm really experiencing this. So all of that impacts patient care, relatability to your provider. And most of the providers didn't look like our patients. And there were so many providers. It doesn't have to be a doctor, a nurse. It could be the respiratory therapist, the radiology technician. And I started seeing that gap and feeling like something needed to be done about that.
So how did you address that?
I was able to start a program. As you mentioned, I went to Cornell and got a master's of science because my advisor told me I needed to do research. You need to document the issue. And I was focused on, at that time, violence prevention and sexual assault. I was seeing the disparities of victims of violent crimes and people of color and wanting to address it. And then I realized that was at the end. The root cause was, access and education and jobs.
Expectations.
Yes. And then you won't end up in this, situation that results in violence or being a victim or a perpetrator of violent crime. So
you want to get in front of it.
Yes. So that's when I started looking at prevention methods. And
what are some prevention methods that you...
I mean, I just think kids, young people, most of the victims of violent crimes we were seeing, or we still see in the emergency department, are young men.
Teenagers.
Yes, and out of school. So keep them in school, keep them motivated and expose them to something that can trigger their brilliant minds, and then we can decrease violence and crime. So that's my belief. There are multiple, systems and multiple prongs in that approach, but I feel prevention, and like you had parents who loved you, gave you a home. You're a wonderfully successful, happy woman. Most of the people I see don't have that, who are in that situation, and or who have health disparities. It doesn't have to be crime, but just depression, the mental health that's present among these young people. It's a generation of depressed, anxious young people who have.
Would you say clinically depressed?
Yes. Mm-hmm. And we just need to take care of our young people and make sure they are educated, informed, and have access to opportunities. So that's what I think the root cause is. And if we could address that, I don't think it's hard. We just don't put the funding and support and manpower where it should be.
Do you notice something missing right now? That something is you. We would love to have you sponsor the podcast and share your work with our Black Female Project family. To learn more, email info@blackfemaleproject.org. Now, back to our episode.
Because the young people that I've talked to, being on the radio and meeting people and going to STEM houses and talking with kids, a lot of them don't feel they have a stake in the game. So why should I care? And then I'd make me depressed too. If nobody cared about my future, what I had to offer, maybe I don't even know what I have to offer.
Right.
Because nobody's pointed it out. And you made such a good point that, like we were talking earlier, people have certain expectations. Like somebody like me would say, well, why don't you just do such and such? Because I had the benefit of that, but that's not on our radar screen yet. And I think it's so wonderful that you can help expose kids and understand clinically what's going on. So maybe you in your profession, you can let your colleagues say, well, this is really what's going on, and this is how we can address it, because what we've been doing, and hadn't been working, Right. So you got to keep it moving. Boom, there it is. So, doctor, what do you do for fun?
I love to dance. I probably would have been a dancer if I hadn't gone to medical school. So when music comes on, I immediately start moving. I see that in my youngest. He's constantly moving. I have 3 boys. So so I dance at home. I go to Zumba, hip hop class, jazz. That's what I do.
Do you cook?
I do love to cook as well. I don't have time to cook as often as I would like, but I do like to cook.
What is your prescription for the future wellness of the Black community?
Oh, that's heavy. Whoa. Man, you're asking me heavy.
I got some more questions too. Just think of it as organic chemistry.
Prescription for the future of the African American community.
Yeah.
I think
from a medical standpoint,
everything that impacts your health comes back to, the root. And I think, as we were mentioning before, we may have been better off during segregation. And I think that part of the solution for the disparity we see among the declining African American community, at least in California, is that we don't economically keep our dollars within the Black community, and we don't support other Black businesses, and then we're just not in community. So if with segregation, despite our classes, we were going to the same churches, same grocery stores, and I'm sure the audience knows more than this than me, but I think all of that then impacts your health. You know, we're hiring therapists, which we need, but my parents tell me, you know, every weekend, everyone was at each other's homes and you were working out marital differences or childhood issues as a community, right? At the kitchen table, because you were in community and talking to each other. And I think we've lost that, in addition to supporting each other's businesses, as I mentioned, and buying Black. Like WeBuyBlack.com is a site that I just started trying to frequent, which is based in Atlanta, Georgia, but it's populated with, you know, you can get toothbrushes and household items from Black-made companies. And I think we do a horrible job among other ethnic groups of keeping the Black dollar within the Black community and then turning that around to help the young man that needs a scholarship or who needs a mentor or who needs a job, right? So I don't know if that directly answers, you know, from a medical perspective, but that is my personal perspective.
I think it's brilliant. Now, I have, before we end our conversation, I have a few questions to ask you.
Okay.
Your name, full name?
Jocelyn Freeman Garrick.
Your occupation?
I am an emergency medicine physician.
And who is your shero?
My mom.
Oh, that's sweet. And then what four women would you put on the Black female Mount Rushmore?
I would definitely put Shirley Chisholm. I would put Rosa Parks. I would put Vashti Turley Murphy.
Who's that?
She was a trailblazer and founder of my sorority, Delta Sigma Theta.
Oh, okay.
And
my family are all AKs. Excuse me.
You're forgiven. Rough draft, where the polished work. And I vacillate between Maxine Waters and Michelle Obama. After reading Becoming recently, and Michelle Obama, our prior First Lady, being so relatable and fearless, I think I would consider her. But it's between her and Maxine Waters.
Okay. Well, that's comprehensive. And it sounds like you and your practice and your life are very comprehensive. And if some young people want to reach out to you, how do they do that? So
we do have a nonprofit, Mentoring in Medicine and Science, and my information is on there. They can go to www.mimscience.org, and a young person can learn about our programs there and contact me.
Thank you so much. You're so inspiring. You really are.
So are you. What?
Well, every other day.
Miss Stanford, and then I Stanford, and then I just did a little something. So yeah.
Thank you so much.
Thank you. It's a pleasure meeting you.
Black Female Project.
We invite you to learn more about the women in this episode, Black Female Project, and ways to support the project by going to www.blackfemaleproject.org.